Our webinar today is titled Alleviate Anxiety Through School Counseling Interventions, and we are happy to be joined by our speakers today, Summer Kuba and Ellen Chance. Ladies, you now have the floor.
Thank you very much, and welcome everybody. We're very happy to see that we have many of you logged on today, and for those of you who weren't able to attend, you'll be able to view this online in the future, as Jen stated. So let's go over, before we do our introductions, just a little bit of what we will be covering today. So here's our agenda for today. We're going to start off with introductions, and then we're going to review our workshop goals. We're going to work on defining anxiety for you, the different types, and the most common types that you're going to see in the school setting. Then we're going to move on to effective counseling interventions and the school counselor's role in addressing anxiety. We hope to have a little bit of opportunity for discussion in our questions section, a little time to personalize what we've learned, and then we will have a wrap-up to be able to answer any questions that are asked throughout the webinar. My name is Ellen Chance. I am a current school counselor in Palm Beach County Schools. I work at the elementary level, though I have experience with middle and high school students as well. I currently serve as the Palm Beach School Counselor Association co-president and have been an active member of FSCA and ASCA. FSCA is the Florida School Counselor Association. I'm a doctoral candidate at Florida Atlantic University, looking forward to finishing up my dissertation. And I also work as a field supervisor for Lamar University, a graduate assistant and adjunct instructor for Florida Atlantic University.
And I'm Summer Kuba. I am actually currently the Florida School Counselor Association chair. I've also been involved with ASCA and planning to present at this year's conference. I am also a doctoral candidate at Florida Atlantic University, where I also am an undergraduate adjunct instructor. I'm currently a certified school counselor at Palm Point Educational Research School in St. Lucie County. I am the middle school counselor there, but I also have elementary experience, and I'm also currently working as a field supervisor through Lamar University. So welcome everyone to our webinar today.
So our learning objectives for today. After today's webinar, participants should be able to identify at least 3 forms of anxiety in children and adolescents, should be able to list evidence-based school counseling interventions and theories that are effective in reducing childhood anxiety, and explain how to appropriately integrate these interventions into their school counseling programs, with keeping the scope of the school counselor and our ethical decision-making in mind.
So Ellen and I have actually presented this a few times at different conferences, and so we're kind of used to that face-to-face interaction, but we're going to do our best to have you participate as much as possible. So really quick, just kind of wanting to get to know you a little bit, we would like to see what levels are out there. So first of all, if you are middle, elementary, high school level,
you can type into the chat box just what level you're in. That'll kind of give us an idea. We're seeing a lot of elementary, high school, middle school coming in.
Awesome.
So it's good to know that we have some varied experience in here. We will do our best to talk about interventions that are effective throughout the different developmental levels.
So the first thing we want to kind of talk about is what your understanding is of anxiety. So first of all, think about what the pros and cons are when experiencing anxiety. So you're obviously not going to turn and talk, but if you just feel like you want to share just your thought really quick of what you feel like a pro and or a con of experiencing anxiety may be. And you can also type that into your chat box at the bottom.
Getting work done. It can be a motivator, absolutely. Sometimes anxiety gives us that little push we need to be successful.
So we have a pro. Does anyone want to share what could be the con when we're experiencing anxiety? Yes, I would see physical reactions to stress, freezes behavior. It can be debilitating. Yes, that's one of the things that we kind of want to focus on, is that there are those positives to anxiety. It's what helps us get things done. It's what honestly helps us get through the day at times. But the con would be that it's so intense that we're actually not able to do anything. We're not able to accomplish any of our day-to-day tasks that we need to fulfill. So then, have you ever worked with a student that suffers from anxiety? And if you did, how was it that you addressed their needs?
Okay, so working on mindfulness exercises, deep breathing, that can be very helpful, particularly when the student is in a state of anxiety or experiencing maybe a panic disorder episode. It could be very helpful to be that person they come to in that time of what might feel like a crisis to them. Okay. Solution-focused technique, that's great to see. That's something we'll be talking about. Creating a safe, supportive environment, that's another thing that we'll be highlighting in this, this webinar today. And then offering a cool-down area, very nice. All right, so we talk about anxiety, and we think about anxiety within our students, and we try to think about what might be our approach to handling it. What might we say to them? And I'm sure that you've heard, whether it be an adult in the building, a parent, but I'm sure you've heard an adult say to a child, just have confidence, take the plunge, life is too short to be sad, it's all in your head. You know, these statements that we might find as words of encouragement, but to a person experiencing anxiety can seem to lack empathy.
And I think one of the things too that we tend to hear, and I'm sure that's even been said to us, is there's nothing to worry about, right? It's no big deal. There's nothing to worry about. You'll get through it. I can specifically remember people saying that to me as a child, even today. Mm-hmm. But we need to remember that for our students, those words, it's easy for us to say, but what they're experiencing inside, especially if they're to the point of having anxiety that's debilitating, is those words are actually going to provide or give them more stress than they already have.
Yes, so they're more counterproductive in nature, and so part of our role as a school counselor is ensuring that we're responding empathetically to students experiencing anxiety, but also that we're teaching the adults that are interacting with these children how to respond to the anxiety and how to provide some empathetic response. So let's go over, in general, what anxiety is. So anxiety can be a normal reaction to stress. Sometimes it's occasional and sometimes it's short-lived. So all of us might feel it before giving a presentation or completing a very important exam. And as many of you stated, it can serve as a motivator or a protective factor even. So it might alert us to a situation we're not comfortable with. It's kind of that fight or flight, where we now feel this heightened reaction to some sort of situation, and we can now have this protective factor of anxiety telling us, hey, we need to get out of here. However, an anxiety disorder is a mental illness that is very serious, and it involves the intense and excessive anxiety along with other debilitating symptoms. So you've heard Summer and I say debilitating already pretty frequently in this webinar. That is our key word here. It's when those symptoms become a hindrance to student, child, or adolescent wellness and performance. So anxiety, the apprehension or excessive fear about real or imagined circumstances. So students might experience anxiety over things that are occurring in life, whether it be some sort of test anxiety, the upcoming, standardized testing. There might be students who experience a very debilitating reaction of anxiety to those types of events. Or it could be imagined circumstances, so things that aren't even occurring that a student feels this level of anxiety over.
And I think another part of that is those imagined circumstances. So, for example, we may have a student who is feeling overly anxious about dismissal time and feeling like no one's going to be there to pick them up. I tend to see that often in elementary school, when in reality, no one has ever left them at school. Their parent has never been late picking them up, but it's this imagined circumstance that they feel that is real. And so for some reason, they just have difficulty working their way through that, or even functioning throughout their day because they're so preoccupied with the event that they have imagined is going to happen at the end of the day.
So let's talk about some of the most common forms of anxiety disorders. The first being generalized anxiety disorder. So this disorder involves the excessive fear. Oh, excuse me. Even if there is little or nothing to provoke the anxiety. So this can occur across a variety of situations. It might not be a result of anything in particular or any identified causes. Whereas panic disorder, people with this condition have the feelings of terror that strike suddenly. They often come about with no warning. The symptoms would include sweating, chest pain, palpitations, even feelings of I can't breathe, I'm choking, I feel like I'm about to have a heart attack. This can come on very strong and very suddenly. Social anxiety disorder, one that we often see in school, also known as social phobia. It involves the overwhelming worry or self-consciousness about everyday social situations. The worry often centers around being judged by others or behaving in a way that might cause embarrassment. Often I'll see students, in my experience, that they have this fear of getting sick in front of others. They have this fear of having an accident in front of others, saying the wrong thing in front of others, and this can really impede their ability to build friendships. It can impede their ability to even just interact in everyday social situations required in a classroom setting. Then there's the specific phobias, an intense fear over a specific object or situation, such as heights or flying. So some of us might have a specific phobia that when that time comes about that we have to climb the stairs or we have to get on an airplane, that we start to feel very heightened feelings of anxiety. I always give the example, the first time we gave this presentation, we were at the Florida School Counselor Association. And the irony of the situation is actually pretty funny. I was driving up to Orlando, which is about an hour and a half, 2-hour drive for me, and I'm in the car, and all of a sudden I see a spider crawling on the dashboard. And at first I'm thinking, okay, the spider's on the outside. It's on the window on the outside of my car. And then, I start to think rationally, and I say, well, there's no way. I'm going 80 miles per hour. There is no way this spider is on the outside of my vehicle. So that is when panic kicks in, and I become this irrational person. I want to pull my car over. I'm calling my husband. I'm freaking out. And mind you, this is a pretty big spider. I literally pulled my car off of the highway at an unknown truck stop, got out of the car, and was refusing to get back into the car until I knew where that spider was. And I had, you know, killed the spider and made sure that it wasn't alive in my car. I was basically ready to trade in the car, to be honest with you. So completely irrational response to a specific situation or a specific element.
And then moving on to obsessive compulsive disorder, which is unwanted or intrusive thoughts, repetitive actions or rituals or movements. And one of the big things here is really those thoughts. That's kind of how it associates itself with anxiety. So it may be this thought of, I'm going to fail the test, I'm going to fail the test, I'm going to fail the test. So that anxiety and that OCD kind of go together and create this create these intrusive thoughts that the student cannot seem to, you know, figure out how to deal with or cope with. And then there's separation anxiety disorder, which, you know, I know we see a lot of separation anxiety when it comes to our kindergarten students, especially at the beginning of the school year. But I can tell you that, you know, you may have a student who has been completely fine with coming to school every day for kindergarten, first grade, and then all of a sudden in second grade at some point maybe something happens. Something triggers it where they're having difficulty getting out of their parents' car in the morning. They're having difficulty separating from their parent at the bus stop. And it's really important to recognize, you know, that there actually could be something that triggered that specifically, you know, whether they're being bullied or something like that, or it could just be more of the realization of the world. I really noticed a lot of this happening around second or third grade, where I have more students who begin to recognize this, and it really seems like it's more of their realizing what the world maybe is really like, that there are some things to be afraid of, you know, whether it's danger. Maybe they've not experienced it, but they're just more aware of what the world is or has the potential to be like at times. So I want to go back really quick for social anxiety disorder. One of the things too that we typically see in school is maybe students who have difficulty in very large settings like cafeteria settings. And I want to see, has anyone experienced that with their students where they have difficulty in those settings like the cafeteria? And if so, how did you handle that? So you can go ahead and type in your chat window. And so, Emily, how did you handle that? Not to call you out, but we see you typed in there. How the student meet in the lunch group? Yep.
Great idea. Good. So pulling them into a smaller group that can work on some of these social skills that might be hindering the child from branching out and feeling comfortable in that big of a setting.
Mm-hmm. I can just give you kind of an example. I had actually a middle school student who, you know, very recently all of a sudden had extreme difficulty in the lunchroom. And the lunchtime is actually my time to go into the cafeteria and monitor, which I use it as, you know, developing those relationships, trying to make it more of a positive than it is a duty. So what I ended up doing with her was I had her sit in a little office near the front office so that she could be monitored. I didn't want to take that whole experience away from her, so what I ended up doing was assigning her some responsibilities. So when she finished eating, she was going around to different teachers and offering help. And she knew, because I had the discussion with her of the teachers are going to be reporting to me how you, like if you speak up, if they can hear you, because one of the things was she wasn't wanting to speak. She would speak, but it was very quiet and very shy. So just to work on some of those skills with her, to get her just used to that interaction more, I did assign responsibilities instead of just taking the environment away from her, because obviously there's going to be things that the students have to learn to cope with in the real world. Book club, lunch group, good. Okay.
So of those disorders that we just gave you an overview of, the ones that you're most likely going to see in the school setting, because they are the most frequently occurring anxiety disorders in youth, include the specific phobias, the generalized anxiety, and the separation anxiety. So why is this important for school counselors? Well, anxiety is the most commonly diagnosed mental health issue for children and adolescents. So very clearly, it's important for us as school counselors to possess the skills and the training and the knowledge in addressing childhood and adolescent anxiety. So let's talk a little bit about what anxiety might look like, sound like, and feel like. So what might we hear? What might we see? What might we feel? And we're going to give you this little clip of a classic film to kind of provoke some of those feelings.
Hey, Mike, I know you got a lot of problems downtown. Hey, Mike, I know you got a lot of problems downtown, but I've got a couple of problems at the house I wish you could take care of. One, I've got some cats parking in front of the house I can't get rid of. And that garbage truck next to the office. So what I need is a red zone. It's a simple thing to take care of.
Honey, would you come here a minute, please? Are you okay?
Yeah, it's fine. It's fine.
Listen, if the kids go to the water, it's worrying you.
No.
They can play out here on the beach.
All right, let them go. It's cold. We know all about you, Chief. You don't go to the water at all, do you? Some bad hat, Harry.
Chief Brody, you are uptight. Come on. That's it.
Okay, so we stopped it right there at that heightened feeling, that classic song that whenever we hear, I think kind of instantly takes us back to that fear that Jaws provokes, right? But what I wanted to kind of touch on is the main character. What were his signs of anxiety? What was he presenting that would indicate, wow, he's really experiencing a lot of anxiety while he's sitting in his lounge chair on the beach? So if some of you could just type in some of the things that you noticed, and then we'll kind of go into it.
And just like that song, the music actually, as many times as we have watched this video and listened to this video, just that music alone kind of makes your heart rate pick up. You know, your heart beats a little bit faster, and that's absolutely what some of our students experience at school. We know for sure, even by watching these videos, that, you know, it's just a movie and nothing's really going to happen, but we still experience some of those same physical symptoms.
Right, and it gives us that anticipation of something that may be happening, right? The anxiety of when is this event going to happen? When are we going to see Jaws appear? That provokes that feeling. But you guys are right, you know, the tunnel vision, the lack of focus on anything that he really should have been attending to, such as the people speaking with him and the conversations around him. The heightened sense of alarm, he was hyper alert to all the children in the water, very tense, quiet. You could tell that he was, you know, tightened, ignoring regular conversation, as you guys said in here. And yeah, you could probably assume that his heart was probably racing. He was, you know, obviously might have been hot out, but it was increased sweating. So these are all great things you guys are pointing out.
And a big one that I've seen on here a couple of times is inability to concentrate.
Yes.
Exactly what we want our students to do all day at school is concentrate. Yet if they're experiencing any type of anxiety, whether it's debilitating or not, it does inhibit their ability to concentrate on what's currently happening inside the classroom.
So signs of anxiety may present differently in children and adolescents than they would in adults. So some of the common signs to be on the lookout for: excessive and persistent worry, restlessness, and irritability, crying or losing their temper easily or frequently. So this is something that an adult might not present when they're experiencing anxiety. But you might have those students who come across as a behavior problem. You might have those students who come across as angry or throwing temper tantrums when really they might be experiencing anxiety. You might have the student who is avoiding and procrastinating. So a little bit of a fear of failure going on where they just begin to avoid situations that provoke any anxiety. They procrastinate on the task at hand. And that could go along in line with that they're just lacking that focus, that attention that they need to be successful. Disruptions to sleep and eating patterns, a decline in academic performance, this is a big one. Truancy and school refusal. So I'm sure you guys have those students who are frequently late to school because their parents probably have the morning battle with them to get them to school because they are refusing. And this is not because they're necessarily defiant, it's because they're experiencing some level of anxiety. Particularly in the adolescents, you're going to see an increased use of alcohol or other drugs. Students who experience anxiety are much more likely to get involved with alcohol and substances. You'll also see withdrawal from social, school, or class activities. So maybe the friends that they once were hanging out with, they're no longer hanging out with. They start to withdraw. And then obviously there's going to be a level of tiredness and fatigue in some of these students as well.
So for those of you that have worked with students who are refusing to come to school, that's a really difficult issue to deal with, especially if you maybe have a parent who kind of enables them, right? So they may cry and say that they don't feel well or they just can't go to school because whatever the reason is. So what are some things that you have done to help in situations such as school refusal or truancy, especially with those parents who are kind of enabling?
Temporary plan to shorten the day, absolutely. Maybe there's an entry plan into school if they're refusing to come to school in the mornings. Implementing a check-in process. Absolutely, offering a calm, safe place.
A sure parent-student can meet with me first thing. Yep, all of those are great suggestions. I have one right now who's missed 58 days of school, which is over a quarter of their sixth grade school year, and also dealing with a parent who's doing some enabling. The student falls asleep regularly in class, which is also that escape mechanism, and so figuring out what to do to help, which it's probably the most difficult thing, because if they're not there, then you can't do anything to help. And then it just perpetuates itself, because when they're not there, then they're getting farther and farther behind academically, which adds to the child's anxiety. So any of those things that you can do, to show them success, add them to those lunch groups where they're developing friendships and relationships with other students, to help them understand that they're not the only one even that goes through difficult times with anxiety.
So let's quickly just talk about the prevalence, because I think that that's an important element for us to know. Excessive fear and worry that meets the clinical criteria for an anxiety disorder is experienced by 10 to 20% of the general population of children. So for every 100 students in your school, there might be 10 to 20 students who are experiencing this excessive level, the debilitating level, the clinical level of anxiety. In lifetime prevalence, you see that for 13 to 18-year-olds, about 25.1 of 13 to 18-year-olds have a lifetime prevalence of the anxiety that meets the clinical criteria. Statistically, it's not different across gender or age.
So if we're looking at the risk factors associated with anxiety, one of those being environmental. So we're talking about, you know, some of those overprotective parents, parents that suffer with anxiety and depression themselves. You know, you may meet with a parent and say, oh goodness, you know, this kind of fits, right? I've met with parents who have very significant anxiety, and you can see it and hear it in their voice when they talk about their home life, or even they talk about their child. And then exposure to violence is a huge risk factor for anxiety. You know, there's that fear that's instilled if they're regularly exposed, which is very, very difficult to you know, it's very difficult to deal with. So it's almost like they're watching train wrecks all day at home, and then they come to school where it's maybe calmer, but they still have those thoughts, feelings, and emotions in their heads. And then there is the intrapersonal. So here we're talking about the brain.
Yeah, so we're talking about kind of going back to what I was saying about the fight or flight. So we have our amygdala response, which that arousal, if it's aroused all the time, it's not beneficial. If it's aroused once in a while in situations where we should feel uncomfortable, in situations where we should make the decision if we need to fight or flight, then that's okay. But these students have an elevated level in the amygdala that causes this level of anxiety and can be very unhealthy. So that could be a risk factor right there. Negative emotionality, or students that have emotional dysregulation, and then these students who lack self-regulation and attention control. So we're going to go into it in a little bit, but a lot of times ADHD can be misdiagnosed when the student is really experiencing anxiety. It's also very important to touch on that self-regulation piece, because as school counselors, we know that self-regulation is a major, major social and emotional skill that we should be working on with our students.
So just some of the issues that overlap with anxiety. You may see, obviously we talked about ADHD already. We may be looking at ODD, oppositional defiant disorder, specific learning disabilities, students that are on the autism spectrum. OCD we already talked about. Something that's really important also not to forget is those gifted students. So we're talking about you know, things that may impact them negatively, such as the ADD and ADHD, but we need to remember just the amount of stress and anxiety that may be placed on those students who are high achievers and may have some of those perfectionist type behaviors. One of the other ones that I wanted to point out specifically was Tourette syndrome. High anxiety associated with that. So all of these things that we've talked about may not live alone in regards to the child. So there may be a bunch of other you know, situations or areas of concern that we need to make sure that we are watching for, even if we have a student who does come into us diagnosed with ADHD, or who does come into us diagnosed with anxiety. They may be experiencing a bunch of other elements as well.
So relationships to other problems. Quickly, let's talk about a little more in depth what Summer was sharing with you. So anxiety and depression occur together about 50 to 60% of the time. When they do occur together, anxiety most often precedes depression. So when we have students that are experiencing anxiety that often goes untreated or unaddressed, it can lead to high levels of depression. And so we see it preceding depression more often than not. When both anxiety and depression are present, it only makes sense that there's a higher likelihood of suicidal thoughts. And also, I want to point out that though the thoughts are present, the attempts are far less frequent. As I have stated, there's also a relationship between anxiety and ADHD. A lot of times, ADHD is diagnosed, and doctors, the parents, even the individuals within the school setting are failing to identify anxiety accurately in this situation. So it's definitely something to be aware of. I know that many school counselors across the country are in charge of taking on the 504 accommodation plans, and we will talk about that. And I know that ADHD can be one of the main medical diagnoses, psychological diagnoses that these plans are developed for. So keep that in mind for the future, that we need to also have anxiety on our radar.
Another problem that we see at times is selective mutism. So if you look at selective mutism, you're looking at a childhood anxiety disorder. Maybe not as common as the things that we saw in the previous slides. However, what you may see is an inability to speak and communicate effectively in select social settings, and that's what's important, is that it is select settings. So there may be settings where the child speaks, and you would never know that there was selective mutism. They feel relaxed, they feel secure, they feel comfortable, but when put in another setting, they completely shut down and are unable to communicate.
I have a student right now, third grade student. He's been with us since kindergarten, and he speaks at home, he communicates at home, he's verbal at home, and at school he is completely nonverbal. We've started to make some progress with this student, but what we've noticed, and why we say this is so aligned with the clinical levels of anxiety, and often anxiety is the underlying reason for selective mutism, is because we have found that when he goes out to recess, he feels comfortable, secure, and relaxed with one student in particular, and he will speak to this student. Last year, it wasn't until the very end of the year that he started to open up to the teacher, not verbally. He would write her notes, and then at the last day of school, the teacher came to me in tears and with goosebumps, and she shared, he came up to me and said, "Thank you," and left the room. And that was the first time all school year she had heard that student's voice. So as you can assume, there's many accommodations that were needed for this student, but he was being treated for our clinical levels of anxiety.
So we touched on this briefly a few minutes ago, but another one that we kind of wanted to stress was Tourette syndrome. Tourette syndrome is a neurological disorder where a person has both motor and vocal tics. You may often see motor tics in students and maybe not as many vocal. If it was just motor tics, you'd be looking at a tic disorder. When you combine both motor and vocal, you're looking at Tourette syndrome. But what's significant about this is that 49% of students with Tourette syndrome have anxiety-related concerns. So if you have a student that presents with you, or a parent lets you know that they have been diagnosed with Tourette syndrome, it's going to be really important that when you're creating a plan for them, whether it be a 504 plan or an individual education plan, that you are putting things in place that address those anxiety-related concerns. It isn't just about the sounds or the movements that they make, but it is about how they're functioning throughout their day in regards to their anxiety and their worry. I have a son who has been diagnosed with Tourette syndrome, So that's something that we have dealt with since he was 5, the very first day that he started kindergarten. That came out. So up until that time, we didn't notice any of those things as far as sounds or movement or even anxiety. He went to preschool with no problems, and it was just that change of setting. We moved into a new house within a week of him starting kindergarten, and things escalated quickly. So it's really important to recognize the anxiety concerns that are related to this. Is typically, there may be something that sets them off, and it will be really important to have a plan in place that your teachers, your administrators, and then just other staff who are involved are very much made aware of.
So we're not going to spend too much time on this because I do want to get to some of these evidence-based interventions, right? We know the problem, what can we do about it? So we know that anxiety is debilitating. We know that it impairs our social skills, academic success, and emotional well-being. As we said, you're going to see weakened school performance, attendance and truancy concerns, definitely poor social skills and difficulty making friends, particularly in those with the social anxiety. You are also going to see that these students are often victimized by bullying because they are seen as those easy targets. And then increased risk of depression, addiction, and suicidality. So let's talk about our role, and let's talk about within our role, what can we be doing in the school setting? So the American School Counseling Association states that a vital element of a comprehensive school counseling program is the delivery of school-wide prevention programs that are comprehensive, developmentally appropriate, aimed at enhancing student achievement, and grounded in data that indicates a need for services. So we know that within a school, there's probably about 10 to 20% of students experiencing anxiety. We know that we want to also work at the prevention element. So we are going to talk about some preventative measures. We're going to talk about some comprehensive evidence-based programs. So how do we first assess the anxiety? We want this to be data-driven. Here are 3 assessments that can be used within the school setting that are brief in nature. The first being the Beck Anxiety Inventory for Youth. This is used with ages 7 to 18. It can be taken by a student, parent, and counselor. So there's a student, parent, counselor version, and it takes only approximately 5 to 10 minutes to complete. We provided the link there for you to print for use. We also have the Behavioral Assessment System for Children, the 2nd edition. This is used for ages 6 to 22, so there's a little bit more of a range there as far as the age groups you can use it with. Again, there's a student, parent, and teacher version. This can take a little longer to complete. It's a little less brief, about 10 to 20 minutes. And then we have the self-report for childhood anxiety-related emotional disorders. This is for ages 8 to 18. It's a student and parent version, and this is quite brief, taking only about 5 minutes to complete. So let's jump into some of the interventions.
So one specifically that we just wanted to focus on is during that individual counseling time, that time where you're able to spend some one-on-one with students, cognitive behavioral therapy. I'm sure most of you know what that is, addressed it in the programs that you attended in school, but just something to remember, we need to teach our students ways to react that help them lead to more desirable outcomes. We can go through things such as muscle relaxation, calm place, which we're going to talk about in a little bit, just things that give them the outlet and give them the coping skills that they may need to to begin to deal with the anxiety that they're experiencing. Deep breathing, guided imagery, you may teach them to do that breathing and count. Even the young ones can very much begin to participate in some of these activities as they learn to deal with their anxiety. We want to teach them to change their negative self-talk, talking to them about, okay, so what are you saying to yourself in your head as your mom is pulling into the, the drop-off area. All of those things, and then teaching them how to reframe that thinking. Exposure, which is something we kind of talked about when we were talking about the cafeteria and those sort of things. Maybe not just throwing them right into the middle of it, but gradually increasing their time in that situation or setting. Assertiveness training is another one for those students who have difficulty standing up for themselves or who just have difficulty communicating in groups with their teachers or with other students. We want to teach them those skills to help them feel more confident and secure and comfortable. Problem-solving techniques, identification and understanding emotions. So, when we begin those sessions with the students, as much as we want to hear the things that are going on with them, we also want to make sure that we're teaching them about emotions. Oftentimes, students don't understand maybe what they're feeling, and they're not able to put an actual word or phrase to it. So just helping them identify those things goes a long way in helping them learn how to cope with it. Recognizing potential triggers is another one, as well as those the way that their body changes when they get anxious or worried. Helps them also start to identify it early so that they can utilize those coping skills before their anxiety reaches a level that may be more difficult to come down from or debilitating.
So here's a very, very helpful resource, particularly for our middle school and high school counselors, especially those who might need to brush up on some CBT. We know through the research that CBT is extremely effective in treating anxiety. So this resource, Cognitive Therapy for Adolescents in the School Setting, the author is Creed Reesweber, and Beck. It's an excellent resource. It's used by school counselors, school psychologists, school social workers, and it provides a strong introduction of the CBT model, but also specific therapeutic techniques that can be used successfully within the school setting. Let's talk about prevention. So I highlighted that as something that we know as school counselors using the ASCA national model that we should be doing. So this program called Friends is appropriate for it's in 4 developmentally appropriate versions. So the first being Fun Friends, which is for children ages 4 to 7. Friends for Life for children ages 8 to 11, and My Friends Youth for adolescent ages 12 to 15, and then finally Adult Resilience for older adolescents ages 16 and older. Each version of the Friends program consists of 10 weekly sessions as well as booster sessions held at 1 and 3 month intervals for program completion. So downside of this program, it's 10 weeks, which can sometimes pose a problem for us school counselors. We have to be realistic. But the upside is that it's evidence-based and it is extremely effective in both in prevention of anxiety, but also in the identification and treatment of anxiety within the school setting.
Another program that is an evidence-based program is Student Success Skills. There's actually a classroom guidance component as well as a small group component. So the target population for Student Success Skills is 4th grade through 12th grade. There's also a component Ready for Success, which is the 2nd and 3rd grade. And basically what those programs focus on is performing under pressure. So it would be talking about test anxiety, managing their anxiety, and providing them with strategies to help them be the most successful that they can be, not just academically, but social, emotionally, as well as in their daily life outside the school setting. It talks about Calm Place, which is actually kind of like a guided imagery where you sit with the students and you can teach them that they can go to their calm place no matter where they're at, right? So you may have a student that says, oh, well, I feel best in my bedroom, and then they think they have to actually be in their bedroom to be calm and to feel calm, and you're actually teaching them that they can go to their bedroom in their head anytime they want, anywhere they're at, they're able to do that. So it's kind of talking them through that strategy. That goes along with breathe, picture focus, which is another calming strategy that's addressed in the SSS program. One of the other areas is positive self-talk and cognitive reframing, which we talked about how important that is also when you are working with students who are experiencing anxiety. We talk about keep cool tunes, another calming strategy where you're talking to the students a lot about the messages that music provides them, right? And so providing that music that is positive and uplifting. I said test taking strategies, and then mental practice again. So what's really important here is that when you're looking at the SSS program, you remember that it is evidence-based. So there's that evidence out there that proves that it has made an impact, a positive impact on students. So as you're doing those classroom guidance lessons, which are 5 lessons once a week for about 45 minutes. So again, that is not a lot of time to spend with students. So it's not taking up a lot of that time, where you'll see some programs are 12 to 15 weeks. And then as you're going through that classroom guidance, the classroom guidance lesson, you're then able to identify those students pretty quickly that may need more kind of intensive small group. And so that's when you can identify those either yourself when you're in the classroom guidance or through teacher referral.
So we talked about Calm Place. This is a strategy that can be used, and it's within the SSS curriculum. Again, it uses muscle relaxation, and it uses also the guided imagery. So a small group counseling intervention. So both the friends and the student success skills can be used as intervention and prevention. This coping cat is a cognitive behavioral treatment. So this is an intervention for students who are identified with anxiety. The program incorporates 4 components: recognizing and understanding emotional and physical reactions to anxiety, clarifying thoughts and feelings in anxious situations, developing plans for effective coping, evaluating performance, and giving self-reinforcement. The program is developed for students ages 7 through 13, and then there's another curriculum for 14 through 17. The target population, again, is children experiencing problematic levels of anxiety. And there also is a parent-caregiver intervention that is offered, which I think to be done at the same time is extremely beneficial.
So another way to help address this anxiety that many of our students experience is through CBT, which we talked about, but as well as play techniques. So we want to make sure that we're focusing on obviously the needs of our students and what they respond to best. So you may have a student that really just needs to sit and maybe they're not ready to speak or share their feelings and emotions, but you may get something out of them through drawing or interacting with a dollhouse, something that helps them to express their emotions and their thoughts. Right, so our big goal is teaching and practicing coping skills. So maybe, like I said, they're not ready to open up, but they are if they're able to hide behind a puppet. So maybe you would use puppetry. Any of those things that help the student express themselves, because toys are their world, are their words, just like it says there, and play is their language. So especially for those young ones, when we're talking about elementary students, we really need to kind of go outside that box of what we're used to and incorporate some play techniques that may help them express themselves. So this is just some examples. You know, role play, puppets, art is a big one. You know, you may ask your students to, you know, draw you a picture of you know, something that they do at home. You can use sand, clay, doll houses. You may do storytelling, music, and storybooks, which I believe I was just going to go a couple more slides here. These are some of the storybooks that I've used when I've worked with some individual students as well in small groups. So I know some schools, you know, finance is an issue and you can't purchase maybe some of these programs, but there are books that are really awesome at helping the students relate to what the character is experiencing. So in third grade, I've done small groups, and we've talked about the Anti-Test Anxiety Society by Julia Cook. Third grade tends to be the very high anxiety time for our students in Florida just because of their state testing. So these are just some books that are really great for students. The Wilma Jean and the Worry Machine, it's a storybook, but there's also an activity book that goes along with it. So you can do, it provides you with small group activities for each week, and I believe there's 5 or 6 weeks that go along with that.
And for those of you who are middle school, high school setting, the anxiety workbook for teens, it can be purchased on Amazon rather inexpensively. Offers activities. A lot of it is framed in CBT, but it really is a wonderful resource. Definitely something to check out if you have not already. So some possible educational accommodations. I know that we're coming up to our hour, and I just want to make sure that we touch on some of the accommodations that these students might need to be successful. So as we know, preferential seating can be important, prearranged breaks, offering an exit plan, so permitting the students to leave the classroom if anxiety becomes unmanageable. So as you said, many of you said maybe offering that calm place, that safe place in the school where they can be supervised by an adult. Definitely working with the parents and or a clinical care provider to understand how the disorder manifests for students. Offering clear behavior management plans, providing explicit guidelines for assignments, so being very clear of expectations and deadlines, making it very clear, cut, and dry. Identifying any changes to a routine well in advance. This can be challenging sometimes within the school, but to try your best within the school setting for these students is very important. Exemption or alternative arrangements. Recognizing small achievements, so let's use that positive reinforcement. Let's recognize the problems that they're getting right, not the problems that they're getting incorrect, things along those lines. Extended time for tests and exams. They might need that time in order to be successful. And then the use of memory aids during exams. So finally, let's just keep in mind our role as school counselors and the scope that we can work with in the school setting. And let's just use our best judgment, our ethical decision making, and know when we really need to start making appropriate referrals, when the situation calls for more than we can offer. So let's just make sure that we're providing those referrals as needed. And then let's build those community partnerships so that we know who we can make the appropriate referral to. So those community agencies, the mental health providers within our community that we know provide excellent care and treatment. So let's discuss, if you just want to, in the chat box, maybe write 1 or 2 things that has stuck with you today, and then we are going to allow some time for question and answer.
And if you have any questions for us, you know, because I know we're kind of at our time now and probably many of you have to go. It's the end of the school day. If you have any questions for us, please email us. We don't mind answering. You know, we have elementary and middle school experience. I have personal experience with my own son experiencing many of these things. So please feel free to reach out to us in email. We would absolutely love to have your questions.
And this is Jen from ASCA, and I just wanted to let everyone know, so the handout, something is malfunctioning with the GoToMeeting handout ability, so I will go ahead and email that to all of the participants on the webinar today as an attachment. So look for that in an email shortly. And ladies, it does look like we have 1 or 2 questions coming in. Maybe if you have time for just 1 or 2.
Of course.
Perfect. Any ideas to help a student who has not come to school for a year and a half?
Well,
he has. It says,
both going to answer. I would say that definitely goes to that referral, you know, the referral slide that we did there at the end. I'm sure probably a social worker has been involved in that.
And I guess my question would be, if the student hasn't returned to school, are they being homeschooled? Is there hospital homebound services being offered to that student? That might be something you explore with the ESE contact at your school, because that is a service that can be offered. Again, anxiety is a mental health disorder, and if students are experiencing that high of a level of anxiety that they cannot come to school, then we want to make sure that we're providing whatever resources we can.
And it could be hospital homebound, but it could also just be the offering of virtual school or something to where they're still able to get the academics that they need, right? Because that's one of our main priorities for students. So if it really is that debilitating, I would think that hospital homebound would definitely be appropriate, or that virtual school where they may get more actual instruction than they would from a hospital homebound teacher.
Great, thank you. How long is the Friends program?
It's a 10-week program, and the sessions are 30 minutes.
All right, perfect. And it looks like that's about all for the questions today. So with that, we'll go ahead and wrap up. And thank you so much, ladies, for the presentation. We're getting some great feedback. So thank you. And thank you, everyone, for joining us today for the 2017 ASCA webinar series. Again, we'll be posting this webinar on our website, schoolcounselor.org. And we'll also be offering webinars in the next coming months. So please check those out if you're interested. And you can register for all of these again on our website, schoolcounselor.org/webinars. Thanks and have a great day.
Thank you all.
Thank you.